So we are bringing you some content today on changes in 2025 to the healthcare industry, and specifically from the perspective of providers. So I saw an article the other day. It told me that potentially 700 plus hospitals in rural communities could be closing down in the next year.
That is because we're all consumers of healthcare.
Correct.
You're a consumer of healthcare. I'm a consumer of healthcare. Jared's a consumer of healthcare.
Yep.
Our viewers are consumers of healthcare. We all are purchasing health insurance each and every day, and we use health insurance the same way that you would use health insurance. Rural, particularly, has been under siege since 2010 when Obamacare was passed. March 2010, Obamacare was passed. First open enrollment is October 2013. Then from that standpoint, ever since then, we have seen networks, carriers come and go, carriers go completely out of business. And now you're seeing the after effects of hospitals and administrations not manage their hospital systems very well, unfortunately, from a financial standpoint. And now, what does that do from an access of care to consumers? Because not everybody lives in a city, clearly, right? We have plenty of people that live in the country and live in rural areas.
Totally.
So now if you're going to close down the one rural hospital that was centrally located for 15 towns, how does that impact those 15 towns that now have to drive 2 hours to go get care?
Right.
That's the biggest challenge that I think will be, that's not a good thing.
Totally. And all the rural places that are staying alive are a lot of them are getting gobbled up by the big health systems who do have maybe great reimbursement rates from carriers. They can hang around. People want to go see them. Think of the Mayo Clinics of the world.
Yeah.
You know, places.
HCA,
Yeah.
Advent Health.
Right. All these big systems. And so it's like, even if a clinic does want to stay alive, I mean, I can't tell you how many times driving through rural Missouri where my, family is from, driving down to see my parents where they live, or driving across the state to St. Louis, how many times you see now name brand systems. Think of Mercy.
Yep.
Just in the middle of nowhere, Missouri.
Yep.
And it's because I would just assume, I haven't interviewed these people that are making these decisions, but it's like, how else are they going to stay alive? How else are they going to stay in business if they can't get the funding from a larger corporation to come in and gobble it up?
Yeah.
Right. So, Luke, you talked about finances and how they manage those being the main cause of it. Unpack some of that for people listening, because a lot of people don't know the background on ACA, how that impacts hospital systems. Unpack some of that and how that is leading to these issues we're seeing today.
Really good question. So I think everything in healthcare obviously has a price, or what you would call, think of like shopping a car, an MSRP price. You go out and you buy and I don't even know what the cost of a brand new Toyota Camry is, but let's just call it $35,000.
Sure.
And so you go to whatever hospital system, whether it's St. Luke's, HCA, Mercy, you name it, Barnes Jewish in St. Louis, doesn't matter. They all have an MSRP for specific procedures or surgeries that need to be done.
Yeah. Sticker
for
price.
Right. Sticker price. Well, the ACA came into action. And when that happened, once again in March of 2010, first year open enrollment in 2013, you had carriers that had awesome networks, Cigna, Humana's, the Aetna's, the United Healthcare's, the Blues of the world.
Coventry at that time.
Which is no longer around. They were the longest standing, oldest carrier ever, and they closed up shop 100% because the ACA caused them to go bankrupt. And that simply was because they were bringing old methodology, and they had old actuaries run models that was supposed to be successful in the ACA. However, whenever you were looking at giving the quality of care, access of care to millions of Americans that were not used to purchasing health insurance before 2013, the first open enrollment, where they are required by law now that they have to cover any and all pre-existing conditions.
Right.
That rapidly changed how carriers fund things. That's why in 2013, the first, ACO, plans, they were PPO networks. They traveled in all 50 states. It was the same plans that everybody was used to buying, but they would have to go through underwriting for. The carriers weren't smart enough, and I don't blame them. That was set up to fail from the very jump start, but they didn't have the correct actuaries in place to understand the loss ratios that were going to happen from taking on pre-existing conditions.
Right. It's probably impossible to forecast.
Correct. Because nobody, I mean, we're talking about millions of Americans that were going uninsured, and now they can go buy a free ACA Obamacare plan that they've never had in their entire life and get everything covered for them at $1,000 max out of pocket. And then the carriers are supposed to receive subsidies from the government, from the taxpayers, general population of taxpayers that are helping cover the difference for that consumer. Well, Coventry, their very first open enrollment from Q4 alone, had taken on 40 major organ transplants. And they had, Coventry at the time had what was called the $0 plan. That was a free plan if you were a certain limit of the FPL limit. And I'm bringing a lot of terms here, so there's going to be things that people
federal poverty limit.
Yeah, federal poverty limit. They had a $0 deductible, and they had a $0 copay plan. As you can imagine, having 40 major organ transplants, which the average major organ transplant is $1 million at the time. They took on $40 million of risk in their first year of offering plans in the marketplace. Nobody could handle that.
Yeah.
There's not enough premium dollars to go around to be able to cover that in that first
And
quarter.
their hands are tied because they have to.
Oh yeah. Now, once the person's bought the plan,
they don't.
And
have
they're on Obamacare, it's required by law that they have to cover any and all exposure above that max out of pocket.
Right.
There is no stop loss. So that was the crazy part that's happened drastically. So Coventry, boom, they're done. They're done and gone. No longer a company. Longest standing firm. They're now gone. Blue KC here locally, we're located in Kansas City. They lost $300 million in the ACA the 4 years that they were in it, from 2013 to 2017, before they exited. They're back into the market, but $300 million. Now, they made plenty of money in their group business, plenty of money in their Medicare business, but those 4 years of being in the ACA, the first four, lost $300 million.
Yeah.
Wow.
So why would they stay in? Of course they left.
Correct. So that's when you saw United leave, Blues leave, Aetna left, Coventry, dead and gone, bankrupt. Friday Health Plans, dead and gone, bankrupt. Bright Health, dead and gone, bankrupt.
Yep.
You've just seen companies that have started from the ground up that everybody doesn't know, they're gone. And you've seen companies that were here forever completely leave the market. Now, that was in the very beginning, from 2013 to 2017, 2018. Then the market began to stabilize. And it's stabilized over the last 5-6 years. But we're about to go through drastic changes again, because since 2020 in COVID, we've had additional stimulus dollars passed by the Biden administration that has been propping up the ACA.
The American Rescue Act.
Yes. American Rescue Act. That is now more than likely not going to get passed by the current administration. The current House nor Senate will pass that. I'll be surprised if they do. Maybe they will. And if it doesn't, then we're going to begin to see all the additional subsidies that came on from COVID. They're going to finally go away, drastically changing the prices, drastically changing max out of pockets, and everything that goes along with that. But long diatribe and tangent of what's happened.
Yeah.
I don't know if you guys would add anything else to that. That doesn't necessarily answer the facilities and rule. It gives you a little bit, paints the picture a little bit of how we kind of dive into that, of how ACA and Medicare plans, reimburse certain levels of Medicare. I don't know if either one of you want to add some commentary to that.
Yeah, I mean, when you're taking on so much risk like you are, think about us going to the grocery store. We're trying to save $1 anywhere we can. You know, if the black beans right next to the other ones are 50 cents cheaper, why would I not grab those? Yeah. And so it's like, think about these carriers taking on all of this financial risk. Of course, they're going to try to save $1 here, cut a contract here. Oh, we can cut out that health system here. We don't need them in our network, or whatever it is, right? Like, of course, you're going to try to, if I can cut you down on a reimbursement rate by 10%, 10% doesn't sound a lot, but when you apply it over the entire year and all services charged, that's a lot of money that you can save. And so providers have had to do the exact opposite. So typically you bill out on a percentage of Medicare. Well, obviously, all those percentages are just going up and up and up and up and up and up and up. And providers are having to bill at a percentage of Medicare that's just obscene.
I've seen 2,000% is the highest I've seen so far.
Yeah. And
of Medicare. And I'm sure there's ones that are higher.
Yeah. I have a good friend who he and I have been going back and forth in our email, just had a surgery, and the final billed amount just for the facility fee was $56,000. And he's like, wow, I cannot believe that that's what they billed for that. Outpatient surgery. It's outpatient.
Wow.
Didn't stay at all. And it's like, well, the provider knows that they're not going to get what they want to get, so they have to overbill to try to get as much to the limit as they can.
Yep.
And so,
Right.
yeah, that's the only other thing I would add. I guess the one other thing I would add is there's been some carriers that have, I don't know, I haven't worked for them, but maybe it's foresight, maybe it's ingenuity, creativity, but they, as the market stabilized, and even before, they turned into Goliaths or gorillas in the market when a Blue Cross and a United and all those exit out. I think of a company like Ambetter completely 100%. Recreated itself,
Right.
and really took off when
We can get into
everybody
the weeds
else
on that, too.
yeah. When everybody else is leaving the market, they find a way to do it successfully. And then you have other companies like Friday and Bright who try to do that, but they were either too late to the game. Maybe they didn't have great leadership. I don't know all the ins and outs of it, but it's just so interesting to see how much it's changed.
One of the things that Ambetter, why I think they were able to get so much market share and manage the ACA block of business so well is they really got started in the Medicaid world. So you've got Medicare, which are those that turn 65 and older, and then you have Medicaid, which are those that are low income. And low income, maybe they don't earn enough to get in a subsidy through the marketplace, so they can turn to Medicaid. Well, when you're a Medicaid provider and you're working at the state level, and your reimbursement levels back to the providers that we were just talking about are actually below MSRP. So instead of, it'd be like you being able to go out and buy that $35,000 Camry, brand new, no issues with it. But now that you're Medicaid, you can buy that same car, and instead of paying 35 grand, you can pay 25 grand with nothing wrong with it. That's what Medicaid is essentially us. Well, when they came in with that, their contract levels that they already have with hospitals and providers, yes, they're paying above Medicaid, but their reimbursement rates to doctors, hospitals, you name it, are not as high as what Cigna's and the Blues were. So Cigna's and the Blues also have group major medical products. So if you are a hospital system and you're Barnes Jewish and you're working with Cigna Healthcare and you know that their group major medical pays you for the same procedure 750% above Medicare,
Right.
the MSRP level, and you have an ACA plan and they know, well, hey, your group product over here is paying us 750%. Why are you trying to pay us 250% just because it's ACA? I know that you can pay 750%. So how about you go ahead and pay us more? Where Ambetter's at, they didn't have a group major medical. They were working with Medicaid. So when they expanded in the ACA, now they're at 280% of Medicare, and they are, half, 3/4 the cost of all these other big providers, and that's how they won market share.
That's genius. Yeah, I never thought about it that way. Yeah.
And that's how they were able to really be successful in the ACA business.
Great insight.
Yeah.
I think what's wild is whenever you speak to a consumer on the phone who's coming from the group insurance world and has never had to dive into buying their own health insurance.
Yeah.
It's just wild to me how many different pieces and nuances, like what we're discussing, they have no idea about. And they come into it not having a clue what they're diving into and all the pieces and changes that have happened in the last 15 years with individual healthcare and how that's impacted what they're now trying to buy and comprehend.
And let me be clear, nor do I expect them to understand or comprehend what we've talked about on this.
Correct.
Really. Because when I'm talking to someone, a consumer that's coming from a group health plan, sometimes there's been a handful of times where I've gone into the weeds this deep. But what I will say is I think it's good information for those that are insurance junkies or just want to know what's really transpired in the last decade. And they want to find out, okay, why are healthcare costs drastically so high? And why can our government not figure this out? Or why can carriers not figure this out? Why are we seeing double-digit rate increases every single year? And this next year, I think, is going to be... You remember in 2018, 19, 20 on the ACA, what we saw? We saw 70% rate increases on the ACA. I'm telling you. I'm telling you, we will see that this next year.
Without 70% subsidy increases.
Correct.
We didn't start seeing crazy subsidy increases until 2020.
What is it in Johnson County? A couple in their 60s can make $150,000 and get subsidy. What was that 5 years ago?
Maybe 62.5. 62.
Yeah. It was...
So it's an increase. You can make $100,000 additionally than what you used to be able to make before you reach out or top out from subsidy, which is huge. I mean, now a couple making, $100 grand, just like you said, they're receiving subsidy from the government to buy a marketplace plan. 5 years ago, they received zero.
Yeah, it was a huge drop off. You're getting close to subsidy, You hit the limit, and it's down to zero.
Yeah.
There was none of this that you continue to tier up.
Yeah.
Wow.
That is what's going to go away in 2025 for 2026
Right.
plans.
I mean, we've already seen a Trump presidency. Like, we've already seen
Right.
how he views subsidies and advanced and increased subsidies.
Correct.
We've already lived through
we'll
that.
also probably see short-term medical plans of some kind come back with this administration. Currently, you can only get those out to 3 months. We will see 12-month short-term medical plans, which are really affordable and for those that are super healthy. Unfortunately, they're not the plan if you are dealing with a cancer or a heart attack or anything like that.
Or you got young kids that need care. Yeah.
Correct. So there's just going to be different options. I'll be really curious if the current administration, Trump administration, will do anything different from products in the U65 space, or are we going to have the same status quo that we had the 4 years that he was already the president? That's the curiosity that lies with me, because I think that's yet to be seen.
Agreed.
Nor do I think whatever plan, let's say he did come out with a plan, I don't know if it passes through House and Senate.
Yeah.
Correct. Yeah.
Nor is that probably his number one priority. You know,
Correct.
he's been in the office for, 2 months now, and
Correct.
we can see all the other things that he's focused on. I mean, this is...
He's working on the next 45 executive orders. Yeah.
So I think that there's a lot of challenges that come into this space and play. And as you dig into the weeds and you follow the money of things, I'm a big believer of price transparency. I think that's been a big thing that this current administration champions. And I think that would help drive. It's just like, why could we not go shop our healthcare?
Yeah.
What's wrong with shopping our healthcare?
It's the only thing you pay for before you know the price.
Correct. And that's where I'm kind of at is, we should be able to go to St. Luke's East, or we should be able to go, or just St. Luke's overall, or HCA, and should be able to take our procedure. There's nothing wrong with any of those hospitals wanting to charge 800% above Medicare, but I should be able to go shop it, get the rate, do that, and then
Make an informed decision.
Make an informed decision on what's best for me and what's best for the cost that's going to hit my pocketbook. And I don't know if consumers are ready for that. I think we're seeing more and more people do that. I mean, we all have seen what health shares, where people are more hands-on now with their own claims. And when it comes to health insurance overall, but health shares, you are hands-on. So as a consumer, guess what? You are taking control of cost of health insurance, period. When you see people go onto plans like that, or short-term medical, or whatever we're wanting to talk about.
Yeah.
Where instead of just paying the bill or knowing that they're going to hit their $8,550 max out of pocket and not caring about that it's going to cost the insurance company 1,400%. That's the problem.
Totally.
We all have our max out of pockets. All general consumers do. At the end of the day, we don't care if what we think quality of care, we go to the one that's more expensive.
Yep.
We don't really care if it's going to cost the insurance company 1,400% above Medicare, above
we don't
MSRP.
care about the insurance company.
People don't right then.
Until it raises their rates.
Until next year when we go
correct.
to renew that plan, and now you see a 70% double-digit rate increase.
Exactly.
And then they're like, whoa, what's wrong with this? Well, maybe you should have shopped the care that you were getting or receiving.
Totally.
And that's the cycle, and it's an endless cycle that we're not doing enough education. People aren't making informed decisions, and we just are handing our insurance card over. We're not checking the price. We're getting our procedure done. Then we get the bill in the mail, and our insurance takes care of the rest. We have been in that model for 40 years, maybe longer, and we do nothing about it.
And it's not easily accessible.
Correct.
You can't just go find it.
Correct.
You have to try to claw pricing
Correct.
out.
Yeah.
And
people don't want to deal with
I'm
that.
not throwing providers under the bus. I'm just saying. And even they don't know, because they're like, well, we'll have to send it in through your insurance. We'll have to hit the deductible, all this kind of thing.
Yeah.
They can't even tell you what. Well, I'm just like, well, can you tell me what you would actually charge? And the answer is that it depends. Depends if you got a PPO plan.
Yeah. If you got an HMO, are you Medicaid level? Would we
Depends
even
what we're
see
gonna
if you're
charge
Medicaid? Yeah, Medicare. I mean, there's all.
And they have a business to run. I'm not.
Yeah.
Not saying anything about them. They got to pay their employees, and they got to run the business.
Well, you bring up a great point. This isn't the facilities or the hospital system's fault either. If you think about the change that they've had to endure the last 15 years of carriers coming and going, networks constantly changing, and they are understaffed just as much as anybody else.
Totally.
They can't keep up with this. The industry period has just been wrought with change overall. We've had so much legislation change, political change, you name it, we've seen it. And so I don't blame the hospital systems or the providers or the doctor offices like, hey, this is the reason why you guys are the reason why we have horrible price increases or price transparency. It's not their fault.
Right.
It's just everybody has to work together to accomplish the goal, which is to drive everyone's cost down. And at the end of the day, that's not happening. I can tell you whose stock prices continue to rise over the last 15 years, and that's the insurance carriers.
Mm-hmm.
I don't see them hurting that bad.
Right.
Look at Cigna, look at United Healthcare, look at any major Anthem. They have all tripled over the last 15 years.
Yeah.
So what they do is insurance organizations is they pass those dollars right back on down to us, the general consumers, and we are paying for that.
Yep.
Or the 700 plus rural providers that are closing down because they can't keep a
Correct.
facility staffed because they don't have the proper funding.
Correct.
Because of what they're enduring from the insurance companies.
You name it.
Yeah.
Or they go give, just like you said, they're in rural area, they're in rural country or rural town, and they're providing a $300,000 cost of care, and they know from an insurance company that that's going to be delayed, just like you said, for 180 days before they even see that. Well, can a hospital system actually endure $300,000 and that's just for one patient,
Right.
for something serious or a gunshot wound or whatever, a heart attack, you name it. There's all kinds of things that could happen. And can they endure that cost of care and wait 180 days before they get paid?
And I think the other problem for them too, and I spoke about this with Ryan on one of the Aspire webinars, was people are starting to view their healthcare benefits differently coming out of the COVID era, and they're starting to look at it from different perspectives, and it has more value to them, I think, from maintaining their health. And so people are also looking to get more out of their health insurance benefits, which only demands more from the healthcare providers.
Yeah.
And so if you're a rural provider that can't keep up with the cost, and you also cannot keep up with the kind of demand that consumers have for the specialty care that they want, a fully staffed practice, different types of doctors in different areas, you're going to get eaten up, which is why we're seeing that.
Absolutely. Couldn't agree more. Well, I think that this is great content. Thanks, Zach, for putting this together.
Absolutely.
I'm excited to see what our networks and LinkedIn have to say about the access to care, cost of care, what they think's going on with rural hospital systems. And I love the feedback. So please share that feedback to both either Zach, myself, or Jared. Jared, we might be able to get some videos out on your social media.
We'll see. Yeah.
We'll see.
You're going to have to. Yeah, you're required to on this one.
We'll see. But one, thanks for tuning in to some content. If you would like to know some more information about this or have a topic that you would like us to talk about in the health insurance industry, let us know. Drop a comment below. We'd love to try and figure out some content for you.
Absolutely. See you in the next video.